Hello, everybody. I'm Carrie Bruno. I'm a registered nurse, IBCLC lactation consultant, and founder of the Mama Coach. I'm pumped because today Kailey is joining us, and I am so grateful. Kailey is a registered nurse, IBCLC, and a Mama Coach in Twin Falls, Idaho. I wanted to do a session on oral restrictions and tongue ties. And Kailey came to mind because her practice sees so many babies for feeding. I thought this could be a relaxed discussion that will hopefully answer some questions. You can put them in the comments if you do, but I thought we would just start the discussion around oral restrictions. I feel, as with all things motherhood, there's so many questions when it comes to tongue ties. Thank you for joining, Kailey.
Yeah, thank you so much for having me. I'm so excited. I love my Mama Coach practice and so thankful to be a part of this journey with you.
I am grateful to share this brand with you because I know you are seeing babies every single week with feeding challenges, right? Like it's a big part of your practice.
So much of what I do is seeing moms and babies kind of full spectrum from little newbies to even 12, 15 months old.
Let's talk about oral restrictions. Do you feel like parents are confused about tongue ties?
Yes, and everyone's gone down the TikTok rabbit hole. And if there's any question mark about feeding, it might be or should be related to an oral restriction. How do you discern? Is it a problem or is it not a problem? What's normal newborn behavior and what's not?
What would you say are some feeding red flags when it comes to oral restrictions?
I like to look at the mom and the baby together, but also separately. So with mom, what I see is significant nipple or breast pain, bleeding, scabbing, cracking at the nipple. The moms have those toe curling pains. They don't even want to latch their baby. And then with mom, we can also see some supply variation. So low supply, right? Because baby can't effectively transfer or move milk. But we can also see the opposite, like this massive oversupply because the baby can't move milk. A mom compensates by fast milk ejection reflexes and tons of milk for a passive type of feeding.
I think it's important when I'm working with babies that are 4 months old and having feeding issues because sometimes the nipple pain has resolved. It's a good question to say, tell me about feeding in the beginning. Did it hurt? Often the story will be, oh, it was excruciating for 3 weeks and it's still not great. It's better, but it's still not great. Like I sometimes see a bit of healing. In some ways, mom has built up some tolerance. They might not have cracked and bleeding nipples at 4 months, but probably somewhere in their story there has been pain.
Yeah, totally. I think that's for sure. Or maybe they're still using a nipple shield at
Mhm.
4 months because they are trying to persist.
Working so hard to feed that baby,
Yes.
right? And so, what about baby?
If we do have true low supply, we see a baby that's not gaining weight well or has fallen off percentiles, it can be one of those colicky babies, which is your tagline, and I love it. Colic is not a diagnosis, it's a symptom. Sometimes we get really fussy babies because they're not transferring any milk. We see a baby bottle feeding, leaking milk out the sides of their mouth constantly, or they're coughing or choking. Those can be interrelated with oversupply or other things, but it's definitely a piece I look at when I'm examining for some type of oral restriction.
An important note is that we're talking about function. A common misconception about tongue ties is diagnosing it strictly on how it looks. Really, how it works is what we should be focusing on because sometimes it might not look great, but if feeding's going well, that baby's happy at the breast, mama's comfortable, that baby's gaining, doesn't really matter what it looks like. But if baby's having a whole bunch of symptoms, or mom is, or they both are, that's telling us something. We need to dive deeper because it could be an oral restriction or it could be other things. There's lots of different reasons for these symptoms. Our red flags should be going off as lactation consultants to think, could this be something anatomical with baby?
100%. I say that all the time, right? It's not about anatomy, it's all about the function. What can the tongue do? What's happening at the breast or the bottle? And what are we seeing, right? That's the whole thing.
If you're watching this and somebody has said to you at a visit where you have not had a feeding assessment, so what Kailey was saying is she assesses mom and baby together, which is watching a feed, and then mom, and then baby. A tongue tie should not be assessed by looking at a baby in 2 minutes and saying, "Oh, looks like a mild tongue tie," or "No, it's not a tongue tie because they can stick their tongue out." That is a red flag.
Mhm. I
Mm-hmm.
also think we're seeing a big shift that providers doing these releases or diagnoses are realizing that. And so standard or gold standard for care is to have the surgical procedure, but then a team so that you can't just walk into a dentist's office, they do a quick assessment and they send you on their way, right? We see that still a lot. What we really want in a release provider is someone that has inclusion of team, whether that's an IBCLC or an SLP or someone who can help with what is to come, because a frenotomy is not going to be a magical fix or an instant cure for the feeding issues that are going on.
If you have had a feeding assessment done and it is determined that this is potentially causing your issues, a next step would be finding somebody who has qualifications to do revisions, correct?
Yep, exactly.
Yeah, and how you find somebody is really good question to ask a provider. Like, how many of these have you done? Because if they're doing one every 6 months, I would potentially look for another provider. You want somebody familiar with oral anatomy of a baby and breastfeeding and bottle feeding and has done multiple revisions, because that tells you they can handle moving you through this process.
Mhm.
Yeah. I think Facebook groups are another potential resource with a grain of salt, because I know the internet's noisy, but often there's a lot of good referrals around people who've had good experiences. So asking around, often your local lactation consultant can help and refer you, because you shouldn't just go straight to a provider. I think working with a team is an important first step before and after you have a revision. Let's talk about what the revision looks like. You are familiar with laser revisions, correct?
There's a couple different tools. Doctors can do revisions with scissors,
Mm-hmm.
CO2 lasers or diode lasers. We're getting a lot of research to support different kinds of lasers for different techniques. In the training class that I did, it's more important which doctor you're picking than what tool they're using. They can be skilled and capable of using any of those. Sometimes parents have specific tools they are looking for. That's a great question to ask also. What tool is that doctor using?
Mm-hmm. And how long does the procedure take?
It just takes normally a couple minutes, really, or less than that. A family is normally allowed to go back with their baby. And then the procedure is just going to be, if we're doing something under the lip and underneath the tongue, the dentist or the doctor spends maybe 30 seconds under the lip and the same underneath the tongue. Um, and we will see immediately what happens is it opens up in like the shape of a
Yeah.
diamond in that area, not because somebody cuts it in that shape, but that's just the way that the tissue kind of release and expands too.
And then what happens?
Yeah, if you are with your lactation consultant, you'll go back to a quiet room. The dentist or IBCLC or pediatrician should walk you through some aftercare steps. They'll probably talk to you about pain management. What are some things that you can do to help calm your baby? Because there are little open wounds now in that kiddo's mouth, and they're going to be a little bit uncomfortable. What's normal? What's not? What's uncommon when we're looking at this? And then they'll talk through, and that may include, I should say, may include Tylenol dosages or ibuprofen if kids under over 6 months old. Sometimes that includes doing like breast milk ice chips or
Yeah.
wound healing. Some providers will recommend stretches to follow, and some don't.
We
And
need
that's
more research on that. Because I've gone down the rabbit hole and there's no real black or white on should you or shouldn't you.
Yeah, and that's going to be very controversial, maybe based on who, right?
Mhm.
Some talk about why this may be more painful for kiddo, so why do them?
Yeah.
Because that can affect them neurologically. And then some look at it more anatomically, thinking we need to retrain the mouth in the proper way to move and function. That's out of my scope to recommend or not
Yeah.
recommend for families, but that will come from whatever provider is doing the release.
It's important to do your homework and choose a provider who has a lot of experience. You can ask about outcomes, read online. They'll have reviews on how things have gone for them. And what about getting baby back to the breast or the bottle, depending on the issue? I want parents to know it's usually not instant. Your baby is used to using their tongue with that oral restriction. Now that it's been released, they have to relearn function. It can take time to see improvement. And some parents get really distressed when it's not instantly better. I can understand why, because you've gone through a procedure and you want that to be for a reason. But I don't think parents should be discouraged. I think it's what comes next after the revision.
I like to see my families 3 to 5 days after the release to really look at what happens next and what was the reason why we ended up doing a surgical procedure or a frenotomy in the first place. Those first couple of days, I don't necessarily suggest big changes in feeding, but if it was for pain, we probably are, along with some nipple healing, going to be significantly better even at that 3 to 5 day mark. Let's say it was a mom who we were supplementing for low supply. Just because you have a frenotomy or a surgical procedure, we don't just cut out the supplementation,
Sure.
right? And so then we can address those things at that 3 to 5 day mark. We can do weighted feeds. We can look at suck swallow ratios. Like, how is baby now doing at the breast? Have we noticed changes in our breast engorgement? Then we can start to make a plan for what feeding changes happen after the surgical procedure.
It's so beautiful to see parents find resolution when they're having breastfeeding issues and then get to the finish line in the sense that their symptoms are resolving, baby is more settled. Like, what a win.
It's a huge win.
Hmm.
Every mom cries when something is happening with their baby, me included. Then to see peace and hope that we can make it to our goals is so wonderful.
It's important to note that not every baby needs a revision. It isn't an automatic thing. It goes back to function and symptoms because sometimes things that look like an oral restriction can be fixed through latch. It can be fixed through changing nipple size. It can be fixed through pumping and increasing supply. There's lots of different ways to find resolution because breastfeeding is complex and not every baby has an oral restriction. I feel like sometimes parents worry that it's a trend or a buzzword, and I really don't think that's the case. Do you?
No, I don't think so. I think a lot too, right? Especially postpartum, and we are thinking about how are we going to reach our goals. I will do anything to reach my goal of breastfeeding my baby. I've tried XYZ, and then we see moms be like, well, find me a provider that can do a tongue release because that must be what's happening, but it doesn't have to be. So that pre-help is really important.
Every breastfeeding issue doesn't equate to an oral restriction. Some do, but not all. And that's why it is so important to have a feeding assessment. Those who follow me, if they had $1 for every time I said the words feeding assessment, because I believe wholeheartedly in that. Another red flag is if you're not being heard, because your story is the answer. There's that physical assessment, but also tell me what your feeding issue is and start from the beginning. If you have a provider who will hear you, they will help guide you down the right path, whether it is an oral restriction or it's a latch issue or it's a timing issue. There's a million different issues that can coincide with breastfeeding issues, but you shouldn't be rushed.
Yeah, totally. And I think too, I would add in the caveat of if you had a prior kid with some sort of frenotomy or oral restriction, you did a release, that doesn't mean that your second or third or fourth needs to also. I don't know. Can I share just like a quick case study?
Mm-hmm.
Okay, I had she just had her second baby. So her first daughter had a release at about 5 months of age. Now here we are with baby number two. She calls me right when this baby is born. We did a visit in the hospital actually because she's feeling a little bit of pain. And so she's wondering, is there a tongue tie? My other kid had a tongue tie. Is this? And I'm like, hey, let's watch this. Let's see what happens. Okay, on day two, now we're actually like scabbed and having some pain at the nipple here. So we start to talk about nipple healing. What can we do? And of course, doing an oral assessment and a feeding assessment with this and waiting until mature milk has transitioned. Once that's a crucial one, we can't really assess for an oral restriction until mom's mature milk has come in because our suck swallow changes so much. Now mature milk has come in. As you look in this baby's mouth, can you see a visible lingual frenulum? You can. Some people may say anatomy wise, not that I can diagnose, but by looking at anatomy, you may hear one thing. Instead of jumping to a surgical procedure, we decided to do some things to help with nipple healing. So we started with ice and cold compress. We started using a nipple shield to help for a day. Then we ended up using apno. And then, hey, let's do all of these things, we adjusted latch, we adjusted some techniques. We actually changed a position on the right breast. After a day of being on apno, we weaned off the nipple shield and that mom never had any pain again. That baby is 2 months old now, and we've never had pain. We haven't had recurrent bleeding, scabbing. But if you looked in that baby's mouth, maybe you could say something different. But it's all about what was happening at the breast. A very different story for this mom without needing a surgical procedure.
I think that's such a important story, and I'm glad that she worked with you because it is not appropriate to do prophylactic oral restriction revisions. I bet that mom felt anxious because her first to get a revision at 5 months means she struggled for a while. So to have that second baby and then all of a sudden have nipple pain is scary and probably brought around a whole bunch of anxieties. But I'm glad that she had the right support to get her to the solution without having to go down that road. Just because you go the first time doesn't mean that you'll have to the second time. The takeaway is having a good provider, a team, of different care providers who listen to you, do a full assessment, and work with you until those symptoms have resolved, and then trusting yourself as well. I think parents know their babies best, and in a system that is so strained and rushed, parents deserve to be heard and listened to. It's always okay to ask for another opinion.
Yeah, absolutely.
So the parents that you get to see are so lucky to have you, Kailey.
Thank you. I feel honored to get to do what I do. I love what I do, and the community that I'm in is just awesome. So it's a pleasure of mine.
Honestly, what a gift. So, thank you for taking the time to come chat with me. This probably brought up a bunch more questions, so if people have any, they can put them in the comments and we'll answer. Thank you for your time and thank you for watching.